Today we're going to be talking about pinching and pain at the front of the hips that you experience while squatting, and some strategies that you can employ to improve this feeling and hopefully get you squatting pain-free pretty quickly. Before we go into some strategies though, we need to look at the anatomy and why this is occurring so that you have a better understanding and what we're trying to achieve and improve with our positioning and motor control so that you no longer feel this pinch. So I'm just going to preface the remainder of this video by saying that if you're someone that consistently feels a pinching or a tightness at the front of the hips while squatting or while sitting for long periods of time, I highly recommend that you go and see a healthcare professional to have this diagnosed. This video is not used to be a diagnosis for femoral acetabular impingement. I am purely showing you some strategies that we have used here at Melbourne Strength Culture with some great success with some clients, and some strategies that you can employ to improve this feeling that you get. So from this picture here, we can notice two things. Number one, I failed kindergarten, and number two, we are looking at the lumbopelvic region, which is pretty much just the region from the lower back or the lower spine down through the hips and pelvis and into the area that the femur or the leg bone articulates and joins onto the hip. So for here we have the spine down the middle. We then have the sacrum here, which is the base of the spine that the pelvis actually attaches onto. We then have the pelvis here in blue. We have the ilium up top. We have the ischium down the bottom. And then we have the femur bone here. So this is our leg bone. And we can see that the leg bone attaches inside the acetabulum. So for today's topic, there's two main things that we need to understand. Number one, at the top of the leg bone, we have what's called a femoral head. So that is where the end of the bone is that attaches inside of the acetabulum in the femur. So it's a ball in socket joint, meaning that the ball, the femoral head, sits inside the socket of the acetabulum. What is FAI, or femoral acetabular impingement? Femoral acetabular impingement is simply just when the ball is inside the socket and we are articulating this joint together and there's movement occurring. FAI occurs when there's some sort of connection with the lip of the acetabulum, so the lip of that socket that the ball is sitting in, and the femoral head. So there's some sort of pinching occurring between those two bones. And this can lead to pain for obvious reason. We're smashing two bones together. Throughout our assessment process here at Melbourne Strength Culture, we noticed that a lot of people present with extension-based lumbopelvic issues. All this really means is that a lot of people are stuck in an extension pattern or excessive anterior tilt, and they do not have the requisite motor control to be able to pull themselves back into a neutral position. And this is going to be the biggest thing when dealing with this tightness or pinching at the front of the hip. Understanding that first and foremost, you need to get yourself out of that extension and back into a neutral pelvis. What this does is it shifts the acetabulum back and it creates space underneath the lip for us to move through flexion. So as the femoral head articulates with that joint, there is more space underneath the acetabular lip. So we here at Melbourne Strength Culture utilize a three-step process to improve an individual athlete's understanding of the position of their pelvis. First, we use the 90-90 hip lift. For this, we have a tutorial that I'll link in the description box below, and it's a great, powerful tool that you can utilize with yourself or your clients and athletes to improve their motor control around holding and maintaining a neutral pelvis. The 90-90 hip lift is fantastic in the fact that it's a low threshold movement, so that it's very easy and non-threatening to the individual. So it's very easy for them to control their body and learn the position that they need to hold. Not just that, but also utilize the correct muscles to hold that position whilst breathing. We know that if you cannot breathe in a position, you definitely do not own that position. So the 90-90 hip lift provides a very powerful tool that we can give to our clients for them to understand, one, how to find a neutral position, and then number two, how to maintain that neutral position while breathing. So step one is understanding how to find a neutral pelvic position. The second step in improving the feeling that you're getting at the bottom of your squat is then taking that understanding of how to find and hold a neutral pelvis and then adding that into loaded movements. So once you have the ability to hold a neutral pelvis and hold yourself in a more neutral position with your lumbopelvic region, the second step is then taking that and applying loaded movements. For this can be very simple things like goblet squats, RDLs, split squats, or lunges that challenge the body in a way that is off the floor, where the proprioception that they get from the floor is no longer there. So now it is up to you and your body to perceive itself in space and to hold and maintain a neutral position. So a goblet squat can be used to take your understanding of how to find a neutral pelvis on the floor in the 90-90 hip lift like we've taught you, and then take that and put it into movement and some motor control, standing up in some actual training, really. So if you take a goblet and then take the teachings that you've learnt from the 90-90 hip lift, which is literally just to pull your pelvis underneath and to pull your rib cage down a little bit. From this position, we can feel the correct muscles holding us into a neutral lumbopelvic position, and then that can then be transferred into the squat itself. So you can see that once I find a good strong position, I'm able to get very deep with my hips without any butt winking occurring. If I pull myself out of that position into extension, I now get to about here. I can already feel some pinching myself, and this is about my depth limit, purely because I've closed off the space that femoral head has with the acetabulum driving forward. So as I come forward into extension, I've pulled that acetabulum over the top, and I've closed off the ability for my hip to move through flexion. So just to reiterate, find a neutral position and then train yourself to maintain that position through movement. The third and final piece that we use is intra-abdominal pressure and core stability. Another fantastic reason why we love the 90-90 hip lift so much is it gives individuals an idea of how to create pressure in their abdomen. And creating this pressure is a very, very big step in creating core stability, which stabilizes the entire hip joint. When this is extremely stable up top, it provides a foundation for the pelvis to stay stable on as well. It's like the foundation in which a building is built. So the third step in improving these feelings that you're getting is creating intra-abdominal pressure and core stability. This all starts with step one, which is finding a neutral pelvis. Once you find a neutral position with the pelvis and the rib cage is centered over the pelvis, we can use our diaphragm to create stability and pressure inside the abdomen, which will then inherently stabilize the hips. If we managed to help you out here with this video, make sure to like and subscribe to our channel. All our links for our socials and our website are in the description box below. You can find us at www.melbournestrengthculture.com. Thank you for watching. As always, happy lifting. Welcome to the culture. Happy to have you on board. Yeah. So if we now look at this from the posterior side, so before we're looking at it from the front, but if we're now looking at it from the back, there's two main muscle groups that affect this ball and socket, this femoral head inside the acetabulum. There's two big ones that we need to talk about. Number one is the hamstrings, and for the sake of this diagram, I'm going to draw them just off the ischium, down into the femur and down into the tibia, down here. So that's number one, hamstrings. And then number two, we have the glutes, which attach all the way across here. Again, I'm not being too careful with this, but they attach all the way in through here. Again, we're looking from the posterior side here, posterior view. So all these and the glutes, and they attach also on the lateral aspect of this here, the very proximal end of the femur. So this is your glutes. And then this is your hamstrings. I hope that makes sense. So we're looking from the back side. So all I want you to think about though is how these two muscle groups affect the actual way that the ball sits inside of the socket. So if you think about hip extension and when that leg moves through extension. If the glutes contract, we can see that they have a very good line of pull of sucking this ball deeper into the socket. Just the way their fibers are orientated and the way the oranges and insertions occur on the two bony structures, the ilium, the iliac crest, the sacrum, all that sort of stuff, but also how it attaches here at the femur. We can see that that glute is going to pull that ball deep inside the socket, which is going to create space inside that acetabulum for the ball to articulate really well, which is what we want. If we have and I put this in quotations, if we have an inactive set of glutes, I'm going to say actually, if you have weak glutes, and these glutes aren't doing their job to the best of their ability, and the hamstrings have to take over as your primary hip extensors, we can see that because of the line of pull of these hamstrings, if you pull this bone into extension, because we're looking at the posterior side here, if you pull this bone towards us, we can see that that's going to leverage that ball forward, which is going to drive it outside the socket, which is then going to close off the space that is inside the acetabulum. This is called anterior glide. Shirley Sarman talks about this a lot. That's who I was presented it with, but I learnt that through Eric Cressy. Obviously, I did an internship there, so I learned a lot through Eric Cressy, and the team, not just Eric Cressy, the entire team there. Shout out to all those guys. They are fantastic. By far, the greatest teachers I've ever come across. But the Eric Cressy team first introduced me to the Shirley Sarman teachings of anterior glide at the hip. All I'm really trying to say is, and I think I'm just going to put this as bonus footage towards the end, a fourth tip almost would be get as much glute activation as you can. Get your glutes strong. Strong glutes suck that ball deep into the socket, and they don't let it slide out of the acetabulum, and that will close space. So when the ball is deep in the socket, it can articulate a whole lot better than if it's sitting out a little bit and the hamstrings are pulling and we're getting some anterior glide of that femoral head pulling outside of the acetabulum. That's going to be bonus footage. So thanks guys. Links in the description. Please follow us. Please subscribe. All the good stuff. Yeah.